David Sinclair, a Harvard professor that researches aging, has a new study showing that his potential anti-aging therapy is effective and safe even months after use. But what did they actually show in the study? Stick around and we'll tell you the cautiously exciting findings of the study in layman's terms. So what's the therapy? It's treatment with 3 genes, or OSK for short, that have been shown to turn back the clock in cells to a more youthful state. OSK belongs to a family of 4 genes called Yamanaka factors that have the power to turn mature cells, such as liver cells, into younger cells. 3 years ago, Sinclair's team showed that a 4-week OSK treatment restored 40% of lost vision in an age-related disease model, glaucoma, in mice. Glaucoma is a great model to test this treatment because it's a leading cause of blindness worldwide, and the risk of glaucoma increases as we age, affecting nearly 4% of the global population. The results from Sinclair's team were a big deal because they showed this new treatment is effective at improving a previously incurable disease and relatively safe, at least in the short term. The most recent study took the impressive benefits of OSK treatment even further. For this study, the researchers caused glaucoma in mice by injecting magnetic microbeads into their eyes, causing increased eye pressure, attempting to replicate the age-dependent glaucoma that occurs in humans with aging. They measured the mice's visual acuity, the ability of the eye to distinguish shapes and details of objects, using a reflexive head movement test before and after glaucoma induction. The researchers then used a virus-based delivery system to deliver a gene therapy, which was OSK, to the mice. They designed 2 treatment groups, one that had continuous activation of OSK and another that needed the genes to be activated by adding an antibiotic, doxycycline, to the drinking water. To the researchers' surprise, mice showed restored visual acuity after 8 weeks of treatment with OSK in both groups of mice, compared to untreated mice, which experienced declining visual acuity due to glaucoma. The data showed that the gene therapy's beneficial effect can be achieved with continuous activation and a controllable system, which would be a major advantage for using similar treatments in humans. This produced the first take-home message from the study. Vision loss due to glaucoma can be safely reversed in mice. The researchers then wanted to see when activation of the OSK gene stopped after doxycycline treatment. This is important because leaky activation has been seen with some gene therapies, even after the genes were turned off. They found that the expression of OSK genes increased significantly after 2 weeks of treatment with doxycycline, then returned to normal levels 4 to 6 weeks after stopping doxycycline, based on 2 markers that they looked at. To see how long the effects of OSK activation remained, they tested the visual acuity of mice months after treatment. They found that there was no spontaneous recovery of visual function in the glaucoma model, meaning that without therapy, these mice were permanently blind. In the mice continuously expressing OSK, the researchers were surprised to find that after 3 months of treatment, visual acuity was even better than before they caused glaucoma in the mice. If reproducible, this is a major breakthrough for OSK therapy. Improvements in visual acuity were sustained for 11 months but then dropped off. The researchers speculated that this decline in visual acuity was due to age-related decline in other retinal layers, those that OSK didn't reach. In the doxycycline-activated line of mice, improved vision gradually declined after stopping OSK expression. However, reintroducing OSK improved visual acuity again, suggesting that cyclical treatments could be effective at the right dose and intervals. Overall, these findings suggest that OSK treatment can rejuvenate dysfunctional retinal ganglion cells in a glaucoma model, leading to a prolonged improvement in visual acuity directly linked to OSK expression. In their previous study, the researchers showed continuous expression of OSK genes in the retinas of healthy mice for up to 15 months was found to be safe without causing tumors or structural changes. Now they want to see if continuous OSK expression remains safe in a disease setting such as glaucoma. To do so, they looked at mice with induced glaucoma that had continuous or cyclic OSK expression. After 21 months, they did not see any differences in body weight or health between the groups, indicating no severe health issues or tumors. They then took a closer look at the retina, where they did not see any changes in retinal architecture, structure, or thickness between control and OSK expressing groups. In summary, long-term OSK expression in glaucomatous mice did not induce retinal changes or tumors, which is an important finding and another take-home message from this study, since treatments with Yamanaka factors can cause tumor growth in some contexts. This study is a good step forward for testing Yamanaka factor therapies in humans because it shows their effectiveness in treating an age-related disease and long-term safety. The possibility for these types of treatments are exciting. Could Yamanaka factors be used to treat other age-related diseases of the retina, such as macular degeneration or diabetic retinopathy, or non-ocular age-related diseases such as Alzheimer's disease and Parkinson's disease? It's not a major leap to envision that these types of therapies will help treat injuries too, such as spinal cord injury. Equally important, could Yamanaka factors or epigenetic reprogramming be used to treat aging? Initial mouse studies suggest that Yamanaka factors could extend lifespan, but many hurdles still need to be crossed, including safety and delivery. In the meantime, the next step for Sinclair's team is an OSK trial in primates to see if they can replicate the success and safety seen in mice. For more information about how Yamanaka factors and epigenetic reprogramming can reverse aging, check out these videos.